everyone, this is Dr. Nikita Consul from the Academy of Online Radiology Education. I work at Baylor College of Medicine in Houston, Texas. In the month of June of this year, there have been many interesting articles that have been published in liver imaging in multiple different modalities, and we have curated some of the most interesting articles pertaining to imaging studies done in liver CT, ultrasound, MRI, and vascular imaging. In this study published in Abdominal Radiology, staging examinations from 23 patients that were done on dual source CT were studied prospectively for any differences in tumor measurements, variability due to variations in the radiation dose, and who was doing the measurements, mainly whether it was done manually or semi-automatically. Tumor size was found to be overmeasured when done manually versus semi-automatically, and was also overmeasured in images that were reconstructed at less than 50% of the original radiation dose, simulating low-dose CT examinations. The conclusion reached by the authors was that reducing the radiation dose level to less than 50% can lower the quality of the staging examination. In this study published in Investigative Radiology, 67 patients with low body mass index and a high risk for hepatocellular carcinoma were prospectively studied and underwent either standard dose imaging or reduced dose imaging with reduced contrast CT as well, called double low dose, for an hepatocellular carcinoma or HCC surveillance examination. In this study, the CT studies that were done with the double low dose were found to have a higher lesion conspicuity for HCC, as well as a higher contrast to noise ratio, but they were not found to have any difference in lesion detection when compared with standard dose imaging. The authors concluded that in low BMI patients, reducing radiation dose and contrast will not affect lesion detection, and in fact will increase lesion conspicuity and contrast to noise ratio. In this study published in Journal of Internal Medicine Research, 234 patients with suspicious lesions in the liver underwent contrast-enhanced ultrasound and CT. They were retrospectively evaluated for a comparative diagnostic value of these modalities for HCC. CT was set as the gold standard, and contrast-enhanced ultrasound was found to have high sensitivity and specificity for HCC, and therefore was concluded to be safe and have high diagnostic accuracy for the assessment of HCC in a patient with a suspicious liver lesion. This study was published in the Journal of Ultrasound Medicine, and in this study, 101 patients with known or suspected fatty liver disease that was non-alcoholic were prospectively studied and underwent ultrasound and quantification of MRI with proton density fat fraction, or PDFF. And among these 101 patients, 90 patients additionally underwent liver biopsy. Using comparative analysis, the authors attempted to derive an ultrasound-derived fat fraction tool called UDFF. This UDFF was then tested against the MRI, PDFF, and liver biopsy and found to perform nearly equivalent to MRI PDFF for the diagnosis of fatty liver disease, especially for low-grade fatty liver disease. It was also found to do decently well for high-grade fatty liver disease compared with MRI PDFF. So the authors concluded that UDFF could provide a non-invasive diagnostic method in addition to MRI PDFF for quantitative diagnosis of fatty liver disease. This paper, published in AJR, provides imaging examples of when contrast-enhanced ultrasound is provided further assessment for hepatic lesions that have been otherwise indeterminate on CT or MRI. Contrast-enhanced ultrasound was found to detect arterial phase enhancement, detect recurrence of HCC post-ablation, differentiate between HCC and intrahepatic cholangiocarcinoma, differentiate between benign and malignant tumor thrombi, and differentiate between benign and neoplastic cystic lesions or adenoma and focal nodular hyperplasia. In a study published in Academic Radiology, 76 patients with hepatocellular carcinoma were retrospectively evaluated for any imaging markers to correlate with GPC3, which is a prognostic and immunotherapeutic biomarker for HCC. These patients were selected because they had underwent contrast-enhanced MRI with an algorithm called IDEAL-IQ, which stands for Iterative Decomposition of Water and Fat with Echo Asymmetry and Least Squares Estimation. They were retrospectively evaluated with intensity values measured on the tumors in different sequences and then correlated with this GPC3 expression. They found that the MRI intensity values on the R2 star relaxometry sequence of the MRI were 86% sensitive and 84% specific for GPC3 expression. And therefore, the authors concluded that these R2 star values could possibly be predictive of GPC3 expression in a non-invasive manner prior to tissue sampling or surgery. In this month's issue of Radiology, this study of multi-phase liver MRI was published in where 152 patients with HCC and surgical pathology available were retrospectively evaluated with MRI for any features that were associated with macrotrabecular massive subtype of HCC, and this is a very aggressive subtype of HCC. The authors found that the presence of substantial necrosis on MRI had an odds ratio of 32 for the MTM subtype, along with a 65% sensitivity and 93% specificity. Because other markers were also measured in these patients, they also concluded that high serum AFP of greater than 100 nanograms per milliliter and BCLC stage B or C were also correlated with the MTM subtype with odds ratios between 4 and 5. Overall, they concluded that substantial necrosis on MRI is a non-invasive method for identifying the aggressive MTM subtype of HCC. In this very interesting radiographics article, the authors provide imaging examples of vascular conditions that are not as easily seen on sonography, but can arise from pre-existent vascular conditions such as prior transarterial embolization of HCC, atherosclerotic narrowing of large arteries, hepatic arterial variant anatomy, portal venous insufficiency thrombosis, or large intra-abdominal variceal shunt and steal phenomena. And what they found is that many post-transplant complications are best prevented if these pre-existing vascular conditions are recognized early on the preoperative CT or MRI imaging, because by the time these patients have post-transplant sonography, it's harder to detect these conditions unless one goes back to the preceding CT or MRI studies. In this British Journal of Radiology study, 14 patients with HCC metastases in the chest were studied for any treatment response after TACE in combination with chemotherapy, but no molecular targeted therapy. Results showed acceptable safety, no 30-day mortality, a 7.1% response, and 100% disease control rate within the first month. Mean tumor size reduction occurred at a rate of 15.6% in the first month, and median overall survival time was 15 months. They concluded that TACE is safe and effective for pulmonary mediastinal metastases of HCC. In this case report published in Clinical Nuclear Medicine, a patient with prostate cancer underwent gallium-68 prostate-specific membrane antigen PET-CT and was found to have a PSMA avid primary cancer or prostate cancer, a solitary osseous vertebral metastatic lesion, and a suspiciously avid lesion in the liver that was concerning for liver metastasis. Based on prior contrast-enhanced CT, contrast-enhanced ultrasound, and follow-up PSMA PET-CT after androgen deprivation, this intrahepatic lesion was diagnosed as a vascular malformation that was mimicking hepatic metastasis of prostate cancer. So the authors concluded that hepatic vascular malformations may retain radiopharmaceuticals such as gallium-68 PSMA. So that's a wrap for liver imaging in June of 2020. For more details, you can read our blog where you can find links to the original publications and full summaries. Please feel free to share your thoughts and any questions with us on the specialty forum, and see you next month.